continuing to be increasing and spreading around the world. But we also know that for a lot of you out there, there's a lot of fear, there's a lot of concern, there's also a lot of fake news. So we've asked you to give us some questions, and we're going to now put some of them to an expert, and that is epidemiologist and biosecurity expert, Dr. Ngozi Arundu. Welcome.
Thank you, I'm glad to be here.
Right, so let's get into it. So one of the questions that we get a lot, quite a popular question from a lot of people, is this coronavirus curable? And where's the vaccine, if there is going to be one?
So at the moment, no, it's not curable. We do not have a vaccine, even though there are vaccine trials, clinical trials that are in play right now. The estimates say that we will probably have a vaccine within 1 year to 18 months. And even though that sounds like a long time, that is quite fast if you think about the history of vaccine development. So that is reassuring, but that's 18 months for us to be on our guard and to be aggressively fighting this coronavirus.
Why is that so quick to get that vaccine? Is that because we've sort of advanced to a stage now where we can get a vaccine that quickly?
Right, there's several reasons for that. One is that Covid-19, the coronavirus that causes that, coronavirus is a family. And so we've had other coronavirus diseases, such as the severe acute respiratory syndrome, which is SARS, as well as the Middle Eastern respiratory syndrome, MERS. And so we already have some practice. There has already been some research happening. So we're not starting from scratch per se, even though this novel coronavirus is novel.
And with the cure aspect, some people have mentioned, what does it tell us that some people have had coronavirus, they've then recovered, and then they've got it again? What does that tell us about?
Well, that's what we're still trying to learn. We're trying to understand what happens when you have it and you build up antibodies against it. And obviously, every person's going to react somewhat differently. Of course, like a healthy 25-year-old, it might be much easier for that person to fight off a reinfection than somebody that is older or that has existing disease.
Within that, some people say to us, so how can I tell the difference between the symptoms of a nasty cold or the flu and COVID-19?
I think that's a really good question. And right now, the case definition, so how scientists are describing and using like a set of, I would say, principles to identify coronavirus is really beyond the symptoms of, having a fever, having body aches, having a cough, which is present in a cold and a flu. It's also about who have you been near. So have you traveled recently to anywhere that has had a cluster of infections or has an outbreak? So of course it would be different areas in China, especially Hubei province, but also right now we have a cluster of outbreaks in northern Italy. We've had some transmission in Germany. I mean, there's different places. So if there's a cluster there, that's part of the case definition. It's not just those symptoms. It's have you been there, one, or has someone in your family been there, a close contact? Close contacts are the most important people in this situation as far as transmission. While we have seen very few cases, limited cases, where they can't really say, actually I don't remember being next to anybody who has been to China or any of these places where there's a community transmission. While we don't have a lot of that, that does exist, and right now a lot of scientists are trying to figure out where they got that from.
Because another concern from a lot of people seems to be that, is it possible to be infected and show no symptoms whatsoever?
So we have seen some of those cases, again, limited cases that are asymptomatic, so not showing any symptoms. That's something that we're still looking at. At the moment, I can't say what percentage because there's so many different population studies going on right now. But for the most part, it seems that people are actually presenting with symptoms, even if they're mild symptoms. And as you know, a majority of people who contract COVID-19 actually exhibit mild symptoms.
And in terms of what we do know, trying to put it in perspective, lots of people want to know, how does this compare to seasonal flu, pandemic flu, the death rate? So what do we know if we want to try and compare this to something like seasonal flu?
Right. So what we know is that it's transmissibility, so how easy it is to infect someone else. It seems like it's similar to seasonal flu, and that means that it's relatively high. As far as its mortality or its death rate, it seems like it's about 2% of the population who, it seems like that, I mean, we're still getting more data, but about 2% of the population who contract COVID-19 are dying. What we have seen in China, where we've had the majority of information because they've had thousands and thousands of people that have been tested and observed, it seems that most people who contract COVID-19 are between 30 years old and 69. Most people who die from it are like around late 60s, early 70s. as far as seasonal flu and its mortality rate, seasonal flu has a less than 1% mortality rate, so more like 0.2%. So COVID-19 at 2% is higher, and much higher actually than seasonal influenza.
Yesterday, WHO said this is not a pandemic yet, but it also said this is not like any other influenza.
Exactly.
So what does that mean?
That means that this strain of coronavirus is nothing that we've seen before.
Is that concerning?
I think it's concerning because we don't have any immunity to it. You know, with seasonal flu, at least we have vaccines. And like this year, the vaccine was quite effective. It was about 44%. For people who actually got the vaccine, they were protected. But what we do know, compared to other viruses that that have respiratory illness or that cause respiratory illness, like what I said earlier about the SARS and the MERS. Now, when you compare it to those diseases, it looks like it's much weaker. So, for example, with MERS, about 30% of people who contracted MERS died. So it's a 30% mortality rate. With SARS, about 10%. So at 2%, it's much lower than those two. Yeah.
Well, I guess some people are concerned that it's, you know, there are figures about sort of 60% of the population or 80% of the population getting it. So is that right? People are asking, is that right? That you could see 60 to 80% of the population of each country of the world getting this virus?
So I don't think that we're able to really confirm how many people or what percentage of the world. Like, yes, in some ways it is possible for many people to get this disease at the same time, but in other situations, so if you even look at seasonal flu, everybody doesn't get seasonal flu at the same time, right? And flu also is seasonal, it's cycles. So we have like a flu period between maybe December and February or March, depending where you are, and then we have another one that comes in the fall. So we just, you know, this was just discovered at in the beginning of December, so we're waiting to see if it has that seasonality pattern as well.
Because I think it was Donald Trump who originally said this, and other people are talking about it, that, you know, come the warmer weather, this will just go away.
This is something that we're hoping and that we're looking at. But again, because this was, what the science shows is that the first cases really spilled over early December, late November. So no one can confidently say that when the warm weather comes that this will go away, but we're hoping that it does. At least for the health systems around the world, it would be a nice break for, you know, to have a bit of a respite, having less people contract this illness in the summertime, so that efforts to respond can be more concentrated. Resources can go just to COVID-19, like isolation and contact tracing. Because right now, I mean, NHS is not just dealing with COVID-19. They have influenza. They have, I mean, in the wintertime is where you have most of the seasonal flu cases. So
because within that, lots of people are asking about what percentage of the cases are going to require people to have medical attention, go to hospital. So, you know, we know about the possible death rate figures, but do we know what kind of figures will actually have to go to hospital and have attention?
Yeah, so at the moment, what we've seen in China is about 20% of those who contract COVID-19 have a severe illness, meaning that they actually need to be admitted into a hospital. And like I said, there is no treatment, but there are things that you can do to mitigate the effect of the virus on your body. You can provide oxygen, you can provide fluids, different things that you can do to manage the people who are cases. Yeah.
And there's questions as well about we know that it seems that it's older people and those with pre-existing conditions are most vulnerable. So people here are asking, you know, if I have asthma, should they be more concerned about the coronavirus?
So I think that is a very good question. And it seems that if you are compromised, especially in your respiratory system, that it would be more concerning, that you would want to, I mean, everybody should be doing precautionary measures. Everybody should be quite vigilant. But what we've seen in China are people who smoke, they were more likely to get severe illness or to die from the disease. So I would think that people who have asthma, bronchitis, or other things, they would also, I mean, just with flu as well, they would want to protect themselves.
And is that for older people or just all demographics?
I would think it's all demographics. Because even though what we're seeing, like a lot of times when the science is reported, it's kind of shown as a quite binary, that only old people die. You know, majority might, you know, a majority of old people who have compromised immune systems or people with compromised immune system or underlying health conditions, those might be the majority that is reflected in the pool of people that are not surviving. But that doesn't mean that there are not cases of young people that have also contracted the disease and died. We saw that quite a few healthcare workers. The one doctor who actually was the first person to report COVID-19, he passed away. And obviously healthcare workers are even more at risk because they're exposed to the virus way more than anybody else.
In terms of a lot of advice, especially we get here in the UK, is all about hand washing. Right? Someone here asks, at what point in the epidemic does hand washing need to be replaced by more stringent measures?
I guess hand washing should never be replaced. So what we know is that this virus can be transmitted through droplets. So if somebody sneezes on you or if somebody coughs, like the little spit that comes out, that is how we transmit the virus. But it also can be transmitted through fomites, so particles that are on surfaces. We still don't know how long the virus can last outside of a person on a surface, but if someone sneezes in their hand and they turn the knob and then you come right after them and then you wipe your eyes or touch your face, you've exposed yourself to the virus. So hand washing should never be replaced. It's actually quite effective, even though it sounds like, oh, it's just hand washing. It's actually very important.
Someone here's asking, a lot of the stuff we know about coronavirus comes from China, where it seems to have originated. Do you believe the WHO's statement about the situation in China?
I do believe it. I just read a mission report, and I also have several colleagues that were on that mission to China, where WHO really triangulated its evidence of what the Chinese officials were saying. So they actually went to the clinics and said, for example, one of the most recent statements by China is that the cases are actually declining. And WHO wanted to know, is China just saying that, or is this actually happening? They went to the clinics and they asked them, like, how is your patient volume? What's going on right now? And they said, okay, a lot of doctors said, at the peak of the outbreak, we had a queue outside of the clinic for people to get in. Now we're seeing maybe one person per hour. So they did go to validate the information that China is putting out. And I will say one other thing is that even though there's a lot of criticism of China, and I think as we do much more journalism and we understand, especially the beginning part of the outbreak, what happened, it seems that after, I would say, maybe the first 3 weeks, what was coming out of China really seems that it was true. It seems that they've done a lot of work. I really, in the past, in other appearances, I have really lauded some of their measures. I mean, other measures such as, the very extreme quarantine measures that they've done, those will need to be really, I think, assessed and understood if they were really beneficial, because, China has also bled into some human rights challenges with this whole thing. But at a very high level, they have very advanced science. They have the resources and the human capacity to construct hospitals in weeks, and they really seem like they've done all that they could to contain it as much as possible.
Because what can we learn about in terms of Iran seems to have quite a high death rate and a small number of cases, and then Italy seems to have become the main area in Europe. What can we learn from those two countries, for example, about what's happening in terms of what the governments are telling us?
Yeah, so I think this is a very good point, because it gives you a little bit more contact to like the case fatality rate, or the death rate, or however we're calling it. So that is very contextual. So in China, with some of its mitigation strategies, with its ability to, they have some really advanced medical procedures that they can do to kind of refresh the blood in individuals that are infected. They saw their mortality rate go down to 1%. Iran has a very weak health system, especially when you compare it to places like China or the UK. So because of the sanctions against Iran, because of its kind of isolation in different political spheres, Iran hasn't been getting the necessary commodities, the necessary technology that they need. And so when you have a situation like that, then when people come to the hospital, they're not able to be treated as swiftly or as comprehensively as someone that goes to like China or to the UK. This is why the WHO actually labeled this outbreak a public health emergency of international concern. It wasn't necessarily because wealthier countries like China or the US couldn't handle it. It's countries that you find in sub-Saharan Africa or across Southeast Asia that if it gets there, it'll be very difficult to contain, and their health systems wouldn't necessarily be able to manage the cases.
But then why does it seem to have been a particular problem in Italy? Because you'd think it's a Western country. Why do they seem to be having a bit more difficulty?
Well, to be honest, I don't know the specifics about the Italian outbreak as far as the cluster. But one thing that I have read is that since we know that more of the elderly are the ones that have either severe disease or that are dying, it's important to look at the demographics of the countries that the outbreak is happening in. If a country has a very high elderly rate, or a specific region in that country, then it makes more sense that the people who contract the disease will be more difficult for them to recover from it.
Because someone here is also saying, if a lot of the people who have the virus show no symptoms or mild symptoms, how is this not spreading exponentially? Could there be a hell of a lot more people who have this that we have no idea about?
So what I would say is that from what we've seen in China, most of the transmission happened with people who were family or close contacts of people who got sick. Does that make sense? So while of course, yeah, I mean, in some ways anything is possible, but I'm actually quite reassured that it seems to be a cluster, like very, very clustered outbreak, not just kind of random people that you walk by giving people the illness. And so that actually helps our response measures much more. So if you can identify every single person that someone who is sick has been in contact with and then isolate them for the incubation period, then we can actually make sure this dies out.
And I'm glad you mentioned isolation because someone here wants to know how self-isolation works with the rest of their family. So this person says, if I get ill, can my wife go to work? Can they go shopping? Can I go in the same room as them? So how does self-isolation work if you were to be diagnosed?
Yeah, I mean, self-isolation means that you stay as far away with other people as you can. So if you are ill and your wife is not ill yet, then you wouldn't be able to you shouldn't sleep in the same room. You should, for 14 days, you should try to stay as far away from that person as possible. If that's not possible, then I believe that there may be some, I believe that there is some instructions about families kind of 14 days if all the family's not going to work or working from home. There's some students that have traveled outside of the UK to Italy for for holiday with like one parent, and when they get back the other parent has to watch them or has to take care of them, and it's likely that that parent, since they're exposed to a child or a spouse that they're taking care of, that it would be good for them to stay at home as well.
And someone also asked, for those with children, if you yourself are diagnosed, is the child at high risk? Because there seems to be some figures about whether young children aren't actually as susceptible to.
Yeah, it does seem that this outbreak isn't affecting young children. It seems from what we know so far that
Is that children below 16 or?
so we don't have that precise information yet. But especially what I'm seeing is like toddlers and babies, which is very different from influenza, which usually affects babies and elderly people, But since we don't have concrete evidence about, what you're asking, like the specific age range or the mechanism that's actually protecting children, it wouldn't be wise to expose children or to put them at risk if you're sick to say, oh, they won't get it, so I can kind of be around them. It wouldn't be wise to do that. But I will say one more thing about self-isolation. Well, first, I think that people also need to be guided by what their work says. I mean, the workplaces need to be following NHS recommendations, but people need to be guided by that. But also, I know that not everybody has the resources or the ability to stay at home. Not everybody has a childminder, and I think this is something that the government really needs to think about when you recommend self-isolation. We really need to think about how do we care for people that don't have the luxury to stay at home or to bring their kids out. Yeah, that's a big issue. I think a big problem.
And of course, a lot of people are also asking about their pets.
Okay.
Can your pet get coronavirus?
So at the moment, we have not seen any cases of human beings transmitting coronavirus to animals. Now, as we know, this is a zoonotic disease, so it started from an animal host. We think it was a bat that may have gotten another animal, that might have infected another animal, and then that animal affected a human being. But we haven't seen the transmission go reverse.
Okay.
Yeah.
So potentially cats and dogs are safe?
Potentially, yes.
Okay. Something about us in the media
Okay.
in general and what we're sort of relaying to people out there. Are we overreacting and causing fear, or do you think, because at the moment you've seen hand sanitizer sales go up, masks are being brought all over the place,
Yeah.
people are stockpiling.
Yeah.
Are we overreacting, or are we sort of preparing quite well for what might happen?
Yeah, I've seen both cases. I've seen very responsible media coverage of coronavirus. I mean, there's also like the idea of making sure you get the right people to talk about this. I've seen some media that have invited like nutritionists, or not to say nutritionists don't understand outbreaks,
We've
but
chosen the right person.
yeah, I hope so. Yeah, and so I think making sure you get the right people, making sure that what you're conveying aligns with the experts. So we know that masks, especially the surgical masks, are not really going to protect you. If you're sick, then you should wear a mask if you have to go outside. But if you're not sick, a mask isn't going to protect you. And the healthcare workers need that. People that work in NHS, if they run out of masks, then we know that they're more likely to get the coronavirus, and they're also more likely to have severe illness or die from it. So we wouldn't want anybody doing that. Now, talking about stockpile. Now, we know that if you self-isolate, then you shouldn't be going to Tesco. So it is a good idea to have some food and some water in your house for a certain amount of days. That's wise. So I think, really being able to parse through the wise messages versus kind of the alarming ones is important. Yeah.
And a final question someone asked is about what international measures would you recommend countries taking in tandem with one another to deal with this outbreak? Or do you think there's been enough dialogue and cooperation between most countries around the world?
Well, I traveled very recently. I traveled maybe a week ago to India, and then a couple days ago I went to Dubai, and then I traveled from Dubai to London. And in that short time, I mean honestly days, I've seen such a ramp up of surveillance in the airports, but it's not uniform. And so that's what I would say, is that even though I think the international community is doing a lot, making sure that we have that uniformity of surveillance, of enhanced, increased surveillance as ports of entry, especially airports, but even ground crossings in some places, and even seaports at some places. That's very
And
important.
is that do you mean like testing everyone?
Not testing everyone, but surveillance is really looking at people that have symptoms. You know what I mean? It's also, in some cases, if you have, it's filling out the International Health Regulation approved forms, so it's easy to contact people if we find out that, like in Northern Italy, we found out later that that there was a community transmission. So it's being able to have all the data and the information that you need to go back to those people, inform them that they may have been exposed by COVID-19, and ask them to self-isolate or to do quarantine measures as needed. So I think that needs to be more consistent across countries. And secondly, communication. One of the big shifts that I've seen from other outbreaks from now is increased communication. With SARS in 2003, Western journalists had to aggressively get that information from China, and now China has been much more transparent, but I'm sure there can be even more levels of transparency. So I think if the governments continue to discuss what's happening, to share the science, then we'll be in a much better position.
Can you describe the test for the virus and how long it takes to be diagnosed?
It takes about 24 to 48 hours from once you get the sample, meaning that it's usually a throat or a nose swab that has the sputum on like a sample kit. From when you take that swab to when you put it into the laboratory, it can be up to 48 hours to get a confirmed case. In the meantime, the person should stay isolated and should continue to have some social distancing from other people. The great thing is that in the past month, really, WHO and partners have really worked to increase the PCR ability, to increase the amount of reagents, the amount of training on this laboratory process, so a lot more countries can test for it. So for clusters that are very active right now, such as the Northern Italy cluster, the advice from Public Health England is to self-isolate, full stop. Like, if you've gone there in the past week or two, you should self-isolate for 14 days. And also, when it comes to outbreaks, what's really important is time, like what you're saying. So as soon as you feel ill, if you've been to one of these places, or if you've been around to one of these places, it's important to report as soon as possible. But at the same time, I want to just kind of emphasize the whole person, place, and time thing, because just being ill, just having flu-like symptoms and really not having any connection to places, if you just go to the doctor because you have like a cold, we can really overwhelm the NHS system. So I think it's very important to remember this person, place, and time, these three factors that are very important to if you have COVID-19 or not.